I welcome you all. How are you? Fine? Yes. Myself, Professor Dr. Rajendra Raghuvir Deshpande, would like to welcome you all in this very interesting today's video. Today's video is regarding a very common skin problem, that is eczema. In Ayurveda, it is called as a Vicharchika. So, Ayurvedic treatment for eczema or Vicharchika, presented by myself, Professor Dr. Rajendra Deshpande, and you all can contact me on the mail professordeshpande@gmail.com or WhatsApp 9226810630. I have the paid services online medical consultation for any skin problems, Palmistry consultations, and on demand I can make the private classes for Ayurvedic students. Let us start with the discussion of eczema or Vicharchika. First, try to understand what is the pathogenesis. Dosha, in the acute stage, there is a problem with the kapha dosha and pitta dosha. But when the disease becomes chronic, there is a vata predominance. Ruksha or the dry property of vata is exaggerated. And what are the dushya? Dushya means the substances which are vitiated by the doshas. So here in Vicharchika, there is a problem with Rasadhatu, Raktadhatu, Mausdhatu, and the Upadhatu of Mausdhatu is the skin or tvak or tvacha. If we consider the srotas, rasava srotas and raktava srotas are disturbed, and other factors for the pathogenesis are ama. Ama is a specific concept of Ayurveda. Whatever the waste product generated or the toxic material generated due to the faulty digestion or faulty metabolism in the body. There is also excessive moisture, that is called as a kledha, and there is also a role or connection of mind in the formation or the development of Vicharchika. In Ayurveda, all the skin diseases are categorized by the name Kushtha. In the Marathi language, Kushta word is for only leprosy. But in Ayurveda, Kushta word is used for many different skin problems. For the Vicharchika, we have the reference from Charak Chikitsa Sthan, chapter number 7. So, Sakanduhu Pidaka Shava Bahusrava Vicharchika. The chief clinical features, the color becomes blackish brown of the skin. Then there is a excessive exudation, that is Bahusrava, eruptions, that is Pidaka, and associated symptom is pruritus or the itching, that is Sakanduhu. So these are iti ekadasha kshudra kusthani. So Vicharchika is one of the 11 problems mentioned about the skin diseases by Charaka Samhita. The ends the explanation of 11 kushta, kshudra kushta, they have written, Charak has written, Pitta Shleshmadikam Prayaha, Kapha Praya Vicharchika. So in Vicharchika, there is an involvement of Pitta dosha and Shleshma or Kapha dosha, but majoritarily it is Kapha predominant condition. So Vicharchika in GP, this is Travi Kushtha, that is a skin problem with Kapha dosha. How we diagnose the Kapha dosha? Lot of secretions are there, and because of the secretion there is itching. Then Ama. Ama means super added bacterial infection that can be considered as ama. This is the specialty of acute stage. But in the chronic stage, there is a vata dominance, which is explained or which is seen by lichenification or hardening of the skin. Causes, basically skin is a site of vata dosha according to Ayurveda. So in any skin disease, ama is main culprit due to the rasarakta dushti. So there is the erythema, vesicles and pustules. What are the causes of ama? Why this toxin is formed? Ayurveda says it is because of the eating of incompatible food stuff. That is viruddha anna. Taking the milkshake, for example, banana and milk together, that is viruddha anna. Second cause of ama is not maintaining the hydration. So the skin becomes dry. Eating excessive spicy or pungent, that also makes the dryness of the skin, unhealthy blood Sour, salty food. So pungent, sour and salty makes the blood impure. Uncleanliness, and most important for the Rasavasrotas, mental stress can damage your Rasadhatu. Clinical features: intense itching at the first stage because of the kapha and ama dosha or ama problem. Then there is erythema, redness, vesicles, pustules after scratching. Sometimes oozing is there, which is called as secretions. And repeated occurrence of this particular problem that makes the skin hard and lichenified. This is called as a Vata dosha problem. The properties of Vata dosh are step by step exaggerated. Ruksha, Khara and Parusha. 1 plus 2 plus 3 plus dryness. Ruksha 1 plus dryness. Khara 2 plus dryness. And Parusha 3 plus dryness. So this is acute eczema. You can see pictures are always speaking aloud than the words. So Vicharchika treatment principles. First, you have to control the kapha dosha. That means you have to control the kandu, itching and secretions. Then you have to control pitta because pitta causes the erythema, vesicles and secretions. So we have to give the treatment kapha pitta hara, which will balance the vitiated kapha dosha and pitta dosha. Next, Rakta Prasadana, purification of the blood. Then, Ruksha Aushadhi, to control the secretions. We have to dry up all the things over there in the skin. Then we have to give detoxification or Panchakarma treatment in all skin diseases. Vicharchika, we decide whether the patient, we can give him the Vaman or we can give him the Virechan, and we give appropriate Shodhana Chikitsa, that is Panchakarma, but basically for Vicharchika, if the patient is little bit, what you can say, the weak, then you can advise the Virechana Chikitsa. In the chronic stage, the Ayurvedic Vaidyas, they give the medicated ghee internally to control the hardening of the skin, lichenification. So you can see the allergic dermatitis on the hand. Okay. So first treatment. There are different variety. The different Vaidyas give the different types of treatment. So I have collected my own treatment as well as others expert treatments. So we can give Amrutadi Duggulu. You can see the cursor over here. 2 tablets. Gandhaka Rasayan. This is a blood purifier. Amruta means Guduchi. This is also best Rasayan for the blood. Okay. So both the things, they clear up the kapha dosha, impurity of the blood. Okay. It is given with the Mahamanjishtadi Kadha. This is the decoction. 2 tablets, and this is 4 TSF with equal amount of water 2 times in a day. Okay. For Vrana Dhavana of Vicharchika, you can use the Triphala decoction. Best way, you can prepare the fresh decoction. That is more important. This is I am showing just for example. You can use the ready-made Triphala decoction as well, but better to prepare the fresh one. And after that cleaning, drying, then you have to apply Nal Pamaradi Kujambu from South Indian company. Arya Vaidyashala Kottakal Nal Pamaradi oil application. See, chronic lichenified eczema. Next, Vicharchika treatment number 2, second prescription. So there is a choice to the doctors, which first one or this one. Here I am using thiostanin tablet. It is also called as the Rakta Shodhak tablet. This is the Ayurveda Rasashala proprietary product, Ayurveda Rasashala company, Pune. We have also the Sukshma Triphala. This is like a Ayurvedic antibiotic. I can say you, this is an Ayurvedic antibiotic, Sukshma Triphalavati. So both 2 and 2, it should be given with Khadira Arishta. Khadir is also drying, it's a Kashaya astringent. So secretions become immediately reduced with the use of Khadira Arishta. Okay, so this is equal amount of water. Then there is a most important external treatment for Vicharchika, application of purified leech. This is important. If erythema and vesicles, leech application for Rakta Mokshan to remove the impurity of the blood. Then if the secretions are there, you can use this powder, Rasamanikya powder and Yashada Bhasma. They both are astringent in taste and they remove the secretions. After getting removing of that secretion, you can apply Vranashodhak tel, or you can mix these powders with the Vranashodhak tel and apply on acute exacerbation. And afterwards, when there is a lichenification, dried skin, then Maha Marichadi Tail you can use. There is not in the picture, but Maha Marichadi Tail you can use. After Ama Avastha, when the bacterial infection is reduced, secretions are less, Kantu is less, then what we can use? This is a Vajraka Ghrita. Vajraka Ghrita from Vaidyaratnam. Can you see? This is the company. This is the company and this is the Vajraka Ghrita. Okay. So this can be given big spoon, 2 spoon with the warm water at night internally. Then there is also medicated ghee. You can use this one or you can use this one. Mahatiktaka Grita. Bitter. Bitter is always best to treat the any ama conditions. Bitter taste is amanashak. To control the lichenification, we can use the Shata Dhauta Dhrita. So, in Vicharchika, Pathya and Apathya is also important. You must take care of the skin, take care of the metabolism, that is regular bowel open, proper hydration of the skin, drink enough water, full body oil massage. If your skin is always dry, go for Ayurvedic Abhyanga 15 once in a 15 days with Kshir Bala oil. This is nourishing oil for the skin. Consume barley, green gram. Spelling mistake is there. I am sorry for that. If you allow me, green gram. I will just correct it. Okay. I will save it over here. And again, we will go back with the PowerPoint presentation. Proper education. Then snake gold, apple, oranges, and carrots. These are good to control the Vicharchika. But you must avoid the alcohol, smoking tobacco, eating too much spicy, chili, garlic, pickles, sour, salty food, incompatible food like milkshakes, banana and milk, eating non-veg frequently, specifically fish, should not be taken. Fermented products like curd should be avoided. Exposure of the skin too much in the hot or too much in the cold weather, chemicals, contact with the chemicals, contact with the cosmetics, artificial cosmetics, soaps, all are bad for Vicharchika. Wearing tight clothes, keeping the late at night and mental stress, all should be avoided. Now, some interesting pictures about eczema. Pictures help in the spot diagnosis. So this is kumkum or allergic dermatitis. At the place of kumkuma or bindi, there is center of the forehead. Allergy to the kumkum. Avoid kumkum for few weeks. This is very difficult in India. If not stopping to put bindi, case becomes chronic and difficult to cure. Actinic name, you must remember the name, actinic or exposure dermatitis. Can you see the patches over here? After exposure to the sun, skin becomes red and inflamed. Lesions increase after exposure to the sun. Problems become less if skin is kept covered. Okay. Actinic or exposure dermatitis, the same. Skin is red and inflamed when exposed to the sunlight, but it is become less automatically when you avoid the sun exposure. This usually affect the face over here, then pinna of the ear, V part here, V part of the neck, dorsum of the forearms and hands, but this is not there under the surface of chin. Here below, here you will not get because that is not exposed to the sun. Okay, then it is not seen on the eyelids and behind the ears there will not be any problem. Contact or allergic dermatitis, spot diagnosis, common in the hands. Can you see over here? Cause because of the soap chemicals used in the factories or fields, gloves. Okay, limited to the area of contact, starts with erythema, papules, and vesicles. Healing, it get healing, but hyperpigmentation remains, and sometimes scar also may remain. This is the dry eczema on the dorsum of the foot, thickening and lichenification due to the chronic itching and scratching. This condition is called as especially this one, lichen simplex chronicus. Wet eczema. This is chronic. This is wet, or this is first stage and then it becomes wet eczema, sometimes exacerbation. Vegavastha in Ayurveda. Dorsum of the feet, thickening and encrustation. Encrustation. Cracks. Can you see the cracks? oozing from the surface. Acute exacerbation may be with secondary infection. The patient may get little bit fever, inguinal gland swelling, lymphadenitis, okay, and sometimes lethargic conditions, fever, and pus is yellow, remember, in the infection, redness, vesicle, and skin ulceration, okay. So this is all about Ayurvedic treatment of eczema or Vicharchika. This is the end of topic. Always remember, when you treat the Ayurvedic cases, Ahar, Vihar, and Aushadhi, diet advice, lifestyle advice, and medicine. So all these videos of Dr. Deshpande on the YouTube channel are for educational purpose. No patient is expected to take direct medicines. Either you visit nearby family physician or nearby family Vaidya, or Dr. Deshpande is here. You can contact me at all the time. Thank you. So I wish you all the best, and I am very much thankful. But I request, please like, share, and subscribe my YouTube channel, and take care of yourself. Thank you very much. We will meet in the next video. Thank you. Bye bye.